Hello, I'm Dr. Jodi Richardson, and you're listening to Well, Hello Anxiety, a podcast where we end the struggle with anxiety and build our toolkit of practical skills to thrive. Hello and welcome back. I am extra excited today because I get to chat with a friend of mine. We're fellow soccer mums, although my daughter's not playing soccer anymore, so I don't know if that qualifies me as a soccer mum, but I was once upon a time a soccer mum. And Siobhan Bonfield and I got chatting on the side, and anyone who knows me knows I'm a chatterbox, and I was so fascinated to connect with Siobhan and her incredible work and learn about her work as a clinical psychologist. And I'm delighted to be able to bring those soccer pitch side conversations, I guess, to you today, because we've had a lot of really great chats while the girls have been out running around. Siobhan Bonfield is a really experienced clinical psychologist, and she works in private practice but also in the public health sector, where, you know, in both areas of Siobhan's work there are patients with a whole broad range of different mental health challenges. And we're here today to talk about a particular evidence-based therapeutic approach that Siobhan is really passionate about and very experienced in. And it's something that I'm really curious to learn more about too, because when it comes to our mental health, and I so encourage you, if you're questioning whether or not you might need some extra help, I always say, yes, go and get it, because you can have a chat with your GP and hopefully get connected with someone who can support you. So once you're getting connected with someone who can support you, different practitioners can specialise in different models or combine approaches, different therapeutic approaches. And so I think it's really helpful for us to start to learn a little bit more about some of these. And the particular approach that we are talking about today is EMDR, which is an acronym for Eye Movement Desensitisation Reprocessing. Say that 3 times fast. And I really wanted Siobhan to be the one to talk to us, because this is a very sort of important part of her therapeutic approach. She has a lot of success with her patients, and I also really love that her approach is compassionate. She is just so beautiful at helping you feel safe and secure and really supported, and even just as a friend having a chat, she's just a really beautiful person to chat to and to learn from. So Siobhan, it's just such a joy to actually have this chat in a more public way here on the podcast today.
Thank you, Jodi, and likewise, I think I got out of bed a little bit easier when I knew I was going to be having chats with you on the sideline. Not that I didn't want to watch my daughter play soccer, but it's not always easy to get up on a Sunday morning in winter.
No, that's so true. That's so true. I know I was always very excited when I'd see that you were there, and it's just wonderful, isn't it? Because we've got this passion in our lives for the mental health of others, and whilst we have very different kind of roles, I've always just loved chatting to you and learning about the different ways in which you're working, what you're seeing out there in the community and in private practice. And of course, I just want to say that there's never stories shared, or it's just very general conversations. And of course, you maintain complete confidentiality. So just in case that wasn't obvious, because of the wonderful way that you work. But it's just interesting to kind of know that there's a great need out there in the community, and that the work you're doing is really impactful and is really making a difference for the people that you work with. And so I know EMDR, as we will refer to it from now on through the conversation, is something that can be really profound in the lives of people who've experienced trauma, who are suffering with PTSD. And I thought a really nice place to start might be to talk about kind of what's the relationship between PTSD and anxiety.
Absolutely. Well, I mean, PTSD is essentially an anxiety disorder. But I wonder, Jodi, if I could go back a little bit and just talk a little bit about what EMDR is before I come back to that question.
Oh, please. Yes.
Okay. So as you said, it's a therapeutic approach. It's a form of psychotherapy which has been applied and can be applied to a broad range of clinical issues. And there's pretty strong evidence base for a number of different clinical issues or diagnoses now, but it is internationally recognised as a frontline treatment for trauma or post-traumatic stress disorder. And as you said, the acronym, we love an acronym in therapy, but it stands for eye movement, desensitisation and reprocessing. And so the eye movement part is about what we call bilateral stimulation. And I can talk a little bit more about that. And it's an important part of EMDR. So EMDR, as you said, stands for eye movement, desensitisation and reprocessing. And so the eye movement speaks to what we call bilateral stimulation. And I'll explain that a little bit more in a minute. But the desensitisation and the reprocessing part speaks about how the memories become less distressing and more distant when they have been processed.
Right. And I can 100% understand how powerful that must be for anybody who has been struggling with vivid, overwhelming thoughts of reliving the trauma.
Absolutely. But memory comes in different forms, and it can be very conscious, like you're saying. People can have very intrusive experiences like flashbacks or nightmares or intrusive thoughts and images. But EMDR also works with people that have what we would call kind of small T traumas. So you've got your bigger T traumas, which is, like your maybe more obvious trauma, like a car crash or war, sexual assault, domestic violence. But we also know that people experience what we would call small T traumas, which is like accumulative, kind of repetitive or prolonged experiences that have an impact on somebody over time and often relate back to earlier on in life. So an example of a small T trauma might be kind of criticism that's repeated, or interpersonal conflict very early on in school, or kind of harsh comments being made to a child that really kind of internalizes that, and it affects how they experience themselves in the world. So when I say small T, it's not that they're any less significant, they're just maybe less obvious. So, I mean, I don't know if you might have another question, Jodi, but I suppose this also kind of links me to then why is that important when we're talking about EMDR? Because EMDR is essentially a model about processing memories. And I'm simplifying something that's very comprehensive and very complex.
We appreciate that.
But, it is essentially a model that supports the processing of memories. And for me, I've trained in a number of different therapeutic approaches, and what's unique about EMDR is that it uses bilateral stimulation, which can be the eye movement. So the therapist would move their fingers in front of someone's face and to get their eyes to go left to right, or it can be tactile taps or auditory taps or some other visual mechanism. And again, this is just one part of the treatment of EMDR. Yes. But it is a part of the treatment that I haven't encountered in other therapeutic models. And essentially, if I try and explain how that works, is that so the model underpinning EMDR, and again, I'll try not to get into the nitty gritty, which can be a bit overwhelming, is that. But it's based on what's called an adaptive information processing model, which is so the main components of this model is that when people experience distressing events, which can be big T or small T trauma, the memories that go inside the mind are inadequately processed. Yes. And so they're stored in memory as fragments in our mind, or we sometimes say they're frozen in time or stuck.
Yes.
And so what that means is that these memories, because they're stored in their original form, they can then, when they're activated, they can then cause the person to experience the same emotion as at the time that they had the event, or over a period of time, the same bodily sensations. It might reawaken the same beliefs, like I'm unsafe or I'm alone, because the memory is unaltered. And it's these memories, which again can be conscious or unconscious, which then can dysregulate our nervous system and cause symptoms like anxiety or depression or low mood or intrusive thoughts.
something that keeps coming back to mind that I'm thinking about while you're talking about this was I recently had a chat with Craig Harper. And Craig is a great friend of mine and a friend of the podcast, and also has 2 of his own daily podcasts. So I just think he's a superstar in so many ways. And we were talking about, we just got talking about motorbikes, and he rides a motorbike. We were talking about safety and various things. It was all sort of in context. And I recalled when we were talking, witnessing an accident. And the accident, like literally, I was on the Pean Highway. I was driving sort of back from Mount Martha towards sort of Mornington, and I witnessed a car pull in front of the through traffic, and the cyclist hit the side of the car, and the cyclist went flying over the top. Mm-hmm. And whilst it was obviously a very, very difficult thing for me to witness, and people quickly stopped and there was help on scene very fast. I stopped also, but I wasn't needed to sort of do any CPR, which I was quite relieved about, to be honest. It was only just returning to that kind of thought a couple of weeks ago when I spoke to Craig that it's really brought it back up for me. And I think I wouldn't have thought of that at the time. I guess I just shared it with my family. I was quite in shock. I was very worried about this person and knew I'd never find out really the fate of that particular motorcyclist. But yeah, it's just really interesting because I guess that would be considered a trauma. I witnessed something that was horrendous and very distressing. And so whilst we certainly want listeners, I really want you as listeners to be, I guess, able to kind of recognise when there might be a need for you to get some help with something, not to sort of dig things up, which can feel like there's no point digging things up if we can't then do so in the presence of a supportive, experienced clinician who isn't just digging things up but helping with this processing of what people have been through. And it's probably something that must feel very frightening. So I want to actually come back to the bilateral stimulation because I'm so curious about the different ways in which this and I want our listeners to be able to sort of picture what it might be like when they're in a session with someone like your beautiful self. But just before we come back to that, could you just maybe speak to the idea that sort of reliving or bringing it up, and I use the words digging it up, and I imagine some people must feel like, oh, this is very terrifying, and I really kind of want to leave it where it is. And why is this so powerful even though it's not easy, in helping the person move forward with better mental health and well-being?
Yes. Absolutely. And so going back to what you described there with the car accident that you saw, what's a normal reaction to an abnormal event? And a car crash is an abnormal event. It's not something that we do, hopefully see often, unless you're an emergency service worker, of course, but is that it's normal for people to have experiences like going over the event in their mind, disrupted sleep, kind of startle response or hyper arousal for a good few weeks after an incident. And we know that many people recover naturally from distressing events, and that some people will need a little bit of help, and that some people will go on to be more significantly impacted. And I think that, the connection with EMDR and the adaptive information processing model is that it is using the brain's, the body's natural processing system to be able to recover. So a bit like, if you have a physical health problem and, you've got an infection, there's medical treatment that support the infection to be healed and to recover. And sort of EMDR is that. It kind of triggers the body's, the brain's natural way of processing memories to recover. Let me give you an example. So EMDR was developed by a psychologist called Francine Shapiro back in 1987. And she had experienced a distressing or a disturbing event, and she was walking in a park, and she noticed that her eyes were moving from left to right. And she was able to join the dots that this natural process of her eyes moving, which is a bilateral stimulation, was helping her work through the distressing event, and that her distress was reducing, and that the memories of the event were becoming desensitized. And so then she embarked on some studies, and so that's how EMDR has developed over time, and quite well, not quickly, but it's certainly grown in the world of psychology or therapy. I think lots of therapists are using it and training in it and using it because we can see the effects that's having. And so, the main mechanism of change with the bilateral stimulation is that it works by forcing the memories, the unprocessed memories, to be processed by stimulating the brain's intrinsic processing system. And so it's again, I'm trying to simplify something that's quite complex, but if I go to your second question around what to expect, so EMDR is the reprocessing is just one part of a very comprehensive therapy. There are actually 8 phases that people will go through when they do EMDR, and so for example, from as a therapist, we'll get a really good history and a formulation of why somebody's experiencing their presenting concerns. And there's a phase of preparation. So clients will be adequately prepared. We call it resourced, where they feel able to kind of regulate their body so that if distressing moments come up in the reprocessing, they're able to manage. And because we know with people that have experienced kind of complex trauma, at that more severe end, that they might use dissociation again as a way of coping. But we'll work with people to make sure that they feel sufficiently resourced to be able to manage what happens. And of course, the therapist is there to support them through that process. Yes. And then there's again a collaborative process of identifying what are some of the target memories that we need to focus on here. And lots of education. It's a what we call a manualized therapy. So we'll actually go through some scripted words to say to people, this is exactly what will happen and why. And we tell them this is how it works, and so this is what to expect. And so then through the actual reprocessing, the client will be aware of what the main memory is going to be focused on, and they are then supported to kind of bring that memory into what we call working memory at the front of their mind. Yes. And then they'll be guided through some bilateral stimulation. Yes. And which activates then the natural processing system. And so the sessions are usually 9 minutes, and it can vary in time in terms of the reprocessing depending on the person, but they'll be supported to just notice what comes up for them. And so what's interesting, and again what's slightly different for me about this therapy in relation to other therapies, is that once the therapy is really set up, the therapist needs to kind of stay out of the way to support the natural processing to occur. And so the client, what the client has to do is just kind of notice what's coming up for them and, work with the bilateral stimulation. Yes. And what we usually find happens is that, people have experiences and different memories come up, and sometimes distress comes up. Yes. And then over time it reduces. And it, again, it can take varying numbers of sessions, from 3 sessions to 12 sessions to 20 sessions. Yes. For some people, it can work quite quickly. For others, they need a few sessions to be able to really experience the benefits.
I so appreciate you giving us a really good understanding of what somebody can expect. And any experienced psychologist will... It's setting the scene, isn't it? It's establishing a therapeutic relationship, and like you say, getting to understand the history and understand what's brought the patient to seek help in the first place. And you're guided, and with not figuratively but metaphorically, your hand is held through the process. You're supported in a safe environment with somebody who understands through experience how to guide a person through the treatment and how much treatment you'll need. I remember, Siobhan, when I first needed help for my mental health, when I experienced major depressive disorder in my mid-20s. I mean, I'd lived with anxiety but didn't know it. And so I ended up suffering with major depression and knew I needed help. And so my GP recommended someone, and that person tried to do role play, like very, like maybe session 2. And I was just like freaked out. I'm like, whoa, hang on a second. Whoa, this is not right for me. And then I went and was recommended by someone at the school I worked in, and I went and saw this person who turned out was somebody who analysed dreams. I'm like, that's not my cup of tea. That's not the right fit for me. And so I think, you know, it's confronting, isn't it? Like when we've got challenges with our mental health, you feel very vulnerable, extremely vulnerable and fragile. And so I think just painting a picture for people as to what they can expect, it just reduces some of that uncertainty, doesn't it? It just reduces that unknown around, well, could this be something that could help me? I imagine there are listeners who are going, hey, I've never tried this before. Maybe this is something that could make a difference for me. And a funny thought came to mind before when you were saying about stimulating the body's natural processing. I love that it's, you know, I mean, the thought that made me sort of chuckle a little bit was this idea of like going and having a wart frozen. You'll see why it's making me laugh.
Yeah.
Because, you know, the body, you know, kids have a wart on their finger and it doesn't go away. And the liquid nitrogen essentially is saying to the body, there's a problem here, come and deal with it.
Yes,
And
absolutely. That's a nice analogy.
Probably not a metaphor that, you know, the EMDR people at EMDR sort of community are going to want to
I don't know, I might use that.
But to me, that was kind of what came to mind, that the body will do this naturally. We just have to guide the body to know what to do and when to do it. And
yes,
and that's,
absolutely.
So so no, look, you're so knowledgeable. And one of the things that I'm kind of wondering, just out of curiosity, because I haven't experienced this, is when it comes to the eye movement, what sort of speed is the eye movement? And is it just following the therapist's fingers? And if it's not using eye movement and it's using bilateral stimulation of another kind, is that like tapping one knee and the other knee? Or tell us a little bit more, please, about what patients could expect, but also why a therapist might use a different approach to the movement of the eyes.
Yes, good question, Jodi. So EMDR in its traditional form used the eye movements at quite a speed. I'm demonstrating, and I know no one can see me. I'm not quite sure how to, but
I'm gonna clap as you do it. You do it.
It was fairly fast.
Yes.
It's fairly fast.
Yes.
And we use slower eye movements when we are supporting someone we call it an installation, when we're supporting someone to strengthen a positive belief about themselves, because the fast bilateral stimulation opens up the memory network. And the slow bilateral kind of closes it down. And so we use the slower when we want to install positive beliefs, which is also part of the later phase of EMDR.
Oh, wow.
But again, research has expanded and therapists use all sorts of devices now. There's light bars, which have lights that go across left to right. I've got headphones, which has noise. Oh. And again, you can set the intensity and the speed. There's also buzzers, which are like tactile in the hands that buzz left to right. Or you can use, get people to do tapping, or another really lovely form of bilateral stimulation is called the butterfly hug, which is where you link your two thumbs. So your hands are like butterflies either side. You put them on your chest and then you tap. And actually, I use the butterfly hugs if I'm feeling a bit stressed or a bit anxious, because it helps calm my nervous system.
Oh, I'm just going to describe for people that what Siobhan's done is she's sort of crossed her wrists with her palms facing her body, linked her thumbs so you could sort of wiggle your fingers and pretend you've got a little butterfly made out of your hands, and then that's you can hear me kind of tapping on my chest as I do that. Oh, I've seen a version of that before, and I think it's really lovely that you've shared that if you feel stress rising, that's a way that you can use bilateral stimulation to settle or regulate your own nervous system, which is something that our
Yes.
listeners can do at any time.
Yes, absolutely. Yes. Yeah.
Yes.
I was just going to go back, Jodi. You might have another question, sorry, but I was
No,
just
good.
wanted to go back to what you said, what we started off in this conversation around PTSD and anxiety, being an anxiety disorder. Is now a good time?
Yeah,
Did you?
perfect. Absolutely
Yeah.
perfect. Yes.
So I suppose just to go back to that point is that, and again, simplifying something that is fairly complex, but post-traumatic stress disorder is the intrusive experiences such as nightmares and flashbacks, the avoidance, like stay away from something that's dangerous, and the hyperarousal. It's again used in the EMDR, or the adaptive information processor model. It's this idea that memories have become stuck and they are frozen in time, so they produce this sense of current threat. I'm still in danger. Which is why when maybe somebody's experienced something traumatic, they might go to the supermarket and feel overwhelmingly anxious because, the body is saying you're in danger. And so through processing some of those experiences, and, the memories become more integrated, more into, more adaptive memory networks, the symptoms of anxiety or post-traumatic stress settle.
Yes, it's incredibly powerful, and you've just again brought to mind, I experienced a traumatic event that I wrote about in Anxious Mums, and I don't feel like talking about it today. I just don't feel like talking about it because we're not here to talk about that. But I've mentioned it before, and it's in the book. But I was hypervigilant. I started to have all sorts of what I thought were nerve problems, numbness, tingling, sadness, just a whole lot of emotions. And obviously I was experiencing PTSD as a result of this experience, but couldn't really remember. I couldn't put two and two together that all of these symptoms started after that event. And I ended up ringing my psychologist, and I'd sort of said goodbye for the last time. Goodbye, like I'll never see you again. Thank you so much for helping me. My mental health is awesome. Off I go in my life. That happened a lot. And rang him up and said, I'm really in trouble. And he just had a chat with me on the phone, actually. He said, I just want you to sort of see if you can sort of piece together when it began. And that as I did that, I realised, oh my gosh. And then I went back and started seeing him. And even though I didn't experience EMDR, but I was able to process. I mean, I'd been with him for years on and off. We were very, very, had a great therapeutic relationship. And now I can talk about it. I don't want to today, but I can, if I wanted to, talk about it without overwhelming feelings of grief or fright or fear or anything like that. And so I've experienced the power, even though through a different approach, because, as we said at the beginning, there's lots of different ways. But this just sounds like it is a really accessible way and a powerful and effective way to perhaps make that change, help people make that change, perhaps in a shorter time than maybe traditional talk therapy. And I wonder, how does it compare, and in terms of the timeline, and yes, I'm going to stop talking and let you answer.
Yes, so a couple of things come to mind. Like, I think it can be incredibly powerful, incredibly quickly, but it's not a panacea. It doesn't suit everybody, but I think it feels for me like it can be a less distressing reprocessing than some of the other more exposure-based treatments I've provided at other times.
Yes.
So, I mean, for some people, if the main aim is to reduce distressing experiences or intrusions, for example, then I think it can work, fairly quickly. But of course, there's what it also does as part of its protocol is support then people to engage in things that they might need to change in their life on top of, once they've done some of the processing as well. Yes. So I suppose just to say that. But I just want to mention what you were saying triggered something in me, because I think what's quite exciting for me as a therapist about EMDR is that there's some other kind of really novel ways coming through. So I want to use an example of two that I've had experience with. And so one is it's a protocol called the Flash. And it's developed by a family therapist in America, I believe, Philip Manfield, and he has used kind of EMDR. So it's part of EMDR, but he developed during COVID, or he applied it during COVID to healthcare workers online as a really preventative measure to support people that had experienced distress and events through their healthcare work during COVID. And so it was, he had like 175 people online, and he guided them through a series of interventions and used like the Flash, which is like this technique that supports rapid relief from memories.
Yes.
And, the results of this study were really significant. I think there was a statistically significant reduction in distress of healthcare workers, which was maintained over time. Wow. And of course, which is very exciting if we think about it's an exciting treatment. It's not exciting when we think about what's going on in the world. I know what you mean. Yes, it kind of. Yes. But the other experience I've had is to use EMDR in a group setting, and again, this was used in the context of a number of people experienced a traumatic incident, and so there's an EMDR consultant here in Melbourne. Actually, that there's a few around Australia, but that has been used in a group protocol where she brings people together, and then collectively in a room they're guided through a series of exercises and use a form of bilateral stimulation, which is tapping, to support the natural processing to take place. So it's preventative. So it's this idea that actually, I've had this really difficult experience, and I probably will recover okay. The majority of people will, but some won't. And so, for me, it's like, well, I will take part in that to engage in the natural process. And a bit like I'll take the antibiotics to make sure, that things are heading in the right direction, or I'll care for a wound in this way, just to make sure things heal well. Yes. And so that also is quite exciting to me, because I think, there's maybe a lack of kind of effective treatments that can help prevent, like acute stress disorder or symptoms of post-traumatic stress disorder develop in a kind of group setting.
I love that you've been able to share that with us. And when I think of, the frontline workers, police, yes, and fire and right, ambulance, and even yes, trauma physicians, there are so yes, many people that every day in, day out, and yes, probably almost become a bit numb's maybe not the word, but just it's kind of just another day in the life kind of thing, that the stuff that they see whilst once in a lifetime for any of us would be quite shocking. They just probably get used to it, but it's detrimental to their mental health and well-being, yes, over yes, their careers and well beyond, and we're losing people from these professions where police here in Victoria are yes, really reaching out for more recruits, and yes, so it's very exciting to know, because when you care so deeply about making a difference in people's lives, what an exciting option to think that people don't have to get so far down the road that they're not able to function in their day, and that it's not, impacting on everyone else in their life and really just ruining their quality of life. It doesn't have to get to that point to get help. It can be way further back up the line.
Yes,
and so
absolutely. Yes.
I want to ask before we finish up, because there's so much more I want to ask you, but I've just been thinking about OCD, because I know there are listeners who live with this or parent a child who lives with OCD, and OCD has been a part of my experience with my mental health, but the medication that I'm on actually has really made quite the difference for that. So I don't kind of really have any challenges with that I can't manage with my skills. But is EMDR something that can be applied to OCD? Is there any research around that?
So look, I don't know if there's any research, but I would hypothesize that there is. I specifically haven't used it for OCD, but OCD is also an anxiety disorder. Yeah. And so what I love about the EMDR world is that there's a lot of research readily available. And there's a lot of protocols that are made accessible to other therapists. So I could imagine that it would be treated in the same way as an anxiety disorder, that there'd be a process of assessment that would explore memories associated with intrusive thoughts and anxiety and feelings, and that could become a target of the processing. So I don't know for sure, Jodi. I'd have to look into it.
So, Siobhan, I can see that you're actually curious enough to dive into this right now.
Yeah.
Tell me, what are you seeing as you're having a look on?
Well, I've got a list of protocols. So when I did the training, the person I trained with is, very well organised and gave me a whole, like a Dropbox, and it's got protocols for addictions, anxiety disorders, attachment, autism, BPD, cancer, children. So, look, OCD is on there.
Right.
So a generalized anxiety disorder, I've got EMDR with OCD, a summary of published papers.
Oh, well, there you go, as predicted. Oh, brilliant. And what that does is, even in that list that you were reading off, it helps our listeners to know that it's an approach, an evidence-based therapeutic approach that can be applied to a whole range of different challenges that people are experiencing. And so
absolutely.
our time's coming to an end, which feels like a flash. It feels like, obviously that word's in my mind from what you said before, but it feels like kind of, we've been chatting for 5 minutes. But I know that there'll be listeners who are thinking, hey, this could be a really good fit for me or for someone I know and love. Where would you direct anyone listening who would like to learn more, or perhaps even find somebody in the EMDR professional world that might be able to support them? What would be a great resource for listeners?
Yeah, so there's a website called EMDRA, or EMDRAA, and that stands for the Association of Australia. And they've got a lot of information on there about EMDR and what's involved, as well as people that have undertaken their training, because of course there's, comprehensive training that needs to be done, and you need to be a member with EMDRA to be on their website, which shows that you are trained to a certain standard.
Yes.
And they've got a list of therapists that are all over the state, and maybe even the country. I suppose I'm in Victoria, I only know Victoria, so I direct people there. But I also think there's a really nice book that's been written, which is called Every Memory Deserves Respect, and it's by Michael Baldwin, and he speaks to his story, and a therapist or an EMDR practitioner called Deborah Korn, Korn, which is also a really lovely read, and some really nice information about EMDR and how it works.
Oh, that is absolutely wonderful. Great resources. What is the website for EMDRA, please?
It is www.emdraa.org.
Oh, easy. Fantastic. So, Siobhan, I am so grateful to you. Honestly, and I could listen to you all day just for two reasons: your accent, of course, and of course your incredible expertise, knowledge, and your compassion for people. And I wanted to say a huge thank you, because it's a big deal for professionals like yourself to say yes to coming and talking on a podcast. I know it's not something that you do day to day, and so I really wanted to say a huge thank you from me and also from all of our listeners. It's just been a joy talking with you.
Oh, much appreciated, and thank you all so much for having me here.
It's an absolute pleasure. And listeners, thank you for being a part of this beautiful podcast community. And I hope that, like me today, I've learned so much today. I have such a curious mind when it comes to these things. And I said to Siobhan when we chatted before the podcast that I'm just going to be, asking the questions that me as a potential client would want answered. So I really hope I've done a good job for you today, and that you've really taken this, into your kind of toolkit as an option for yourself or for somebody that you love. So thanks again for your time. I cannot wait to be back with another wonderful guest next week. Okay, bye. Thank you so much for joining me for this week's episode. If you enjoyed it, please subscribe and leave a review. To keep the conversation going, I'd love you to join me over on Instagram. You'll find me at Dr. Jodi Richardson. Also, if you'd like a copy of my free 5-day mini email course, Calm Your Anxious Brain, then jump over to my website, drjodirichardson.com, and you can sign up down the bottom. I've really enjoyed having your company. Thanks so much. See you next time.